I hope everybody can see the screen as well. If you cannot, then speak up. Or if anybody has a technical problem with the mic, then also you can DM me if you would not be able to speak during this quiz. Okay. So I'm assuming everything is clear. And Hardik, give me a green flag whenever we are live. Okay. So let's start.
They're live. I think Hardik, we can also ask
The differentials
them to Amit to turn on the chat for the live stream in case anybody wants to answer in the YouTube chat. I don't know if you guys want.
No. We'll skip that. Okay. So first round is what we call the differentials round. So here the concept is that the more difficult the question, less the number of people would be able to answer it, and that would increase the worth of the question. So essentially, the marking scheme goes something like this. It's every question is most questions in this round are funda based questions. So you have to give me the funda behind some physiological or medical phenomena, and please be brief on the explanation. Use as many technical terms as you can so that I know you are getting the essence of the question. Uh, the I know the marking would be really subjective, but just be sure that you use technical terms, and also try to frame the entire answer in one chat. I do not want that you break up those answers into different chats. Anyway, at the end, I will have to ask you to give me the answer in one chat box, right? If the funda you are getting towards it and still haven't reached at where I want you to reach, I will give you extra time to elaborate on that. No problems there, right? Getting to the exact rules, there will be 8 questions. Every question can be attempted by every one of you as in DM. 30 seconds would be given after I read out the question, and I'll be having a timer for that. Any question that all of you feel like that more time should be given, 30 seconds would be appended, but everyone should be in agreement. Right? There are no negative markings for this round, but you can only make a single guess per question unless specified by me that you can elaborate more on what you said previously, right? Every time I get a DM, I will speak out that I got it and it's correct. Keep the score, right? And again, most of the questions are funda based. Try to be brief. Use as many technical words. Uh, don't don't give us like whole paragraphs and stuff. Just give me the indication that you understood what is happening, and minor variations will of course be accepted. Will be lenient in this round. Okay, and be sure to give all the answers as two organizers in DM. Okay, and no team will be eliminated as of this round. One team will be eliminated after 2 rounds that we'll discuss later. So are we ready for question number 1? Okay. So after I read out the question, 30 seconds will be provided, right? I will give you an indication when 10 seconds would be left, and then we close. And I would constantly be speaking up and acknowledging any DMs I get, right? Okay. Let's move ahead to the first question. A 68-year-old male in the left upper arm, and 2 months later, unsteadiness and instability, especially while walking, which still persists to this day. He was asked but denied tinnitus and auditory disturbance. The physician had an idea, to confirm which he ordered a digital subtraction angiography of the neck and chest arteries. What do you think the physician is expecting from the digital subtraction angiography he ordered? And what is the funda that connects the initial presentation? Note that the initial presentation was numbness in the left upper arm, and the symptoms that presented 2 months later, which was unsteadiness and instability while walking. Your time starts now. I'm just looking for a couple of words here and there, just so that you know symptoms are related. numbness in the left upper arm, and unsteadiness and instability that developed 2 months later. And what would you be expecting in a digital subtraction angiography? Okay. I have got a DM from Shubhra Jyoti. The time is almost over, but I'll give you 10 seconds more. I have just got a DM from Shubhra Jyoti, which is not exactly what I was hoping for, but there are no negative marks. He does not get a positive either. Okay. Soham, you would need to be more elaborate than this, because that's essentially what a DSA is. Okay. Mokshal also has attempted, but is incorrect. I will give Soham, the window is over. I'll give Soham another chance to elaborate on what he's just said. Sara, that's incorrect, but also your time was up, so I would not even consider reading that. Soham has been given a chance to elaborate on what he's just said. Okay, so I would not award anything, anything for this round. So the thing is, this is what's called a the thing was, there was what he found was a subclavian artery blocked before the vertebral artery, right? So essentially, the subclavian block caused left-sided numbness, and because the vertebrobasilar system compensated, the circle of Willis compensated 2 months later, that developed a vertebrobasilar insufficiency in the circle of Willis that supplied the parts related to the vestibular apparatus and stuff. So that is why the two symptoms were related. 2 months later, the subclavian stealed blood from the vertebrobasilar system, and therefore symptoms developed. I hope the concept is clear now. Okay. Now we'll move on to the next question. Hardik, nobody got anything for this question. Okay. Next question is this. This is a pretty easy one. Viagra was an immediate hit in the European market. Within 6 months, 5.3 million prescriptions were written. Within 2 years, 20% of men at risk for erectile dysfunction had been treated with sildenafil citrate. And the drug swiftly captured 98% of the market for the treatment of erectile dysfunction. A common side effect of Viagra is transient blue-green color weakness. What is the funda behind this? Your time starts now. Okay, Shubhra Jyoti attempted, and he'll be given marks. Mokshal, I need you to elaborate on that. Simar will get marks. Bhavya will get marks. Okay, I'll give Mokshal also. I hope you're noting it down. Okay. Soham also get marks. The specifics of the number, I wouldn't I don't really want the specific of the number of the enzyme or whatever it's doing. So no need there. That's about it. Time's up. Sara does not get marks because that is essentially not the answer. Okay. Soham gets marks. Mokshal gets marks. Bhavya, Simar, and Shubhra Jyoti. I hope Hardik has noted that down. So what happens is Viagra is a phosphodiesterase inhibitor, right? As we all know, that's its mechanism of action. But in the nobody gave the exact answer what I was. So what essentially happens is in visual transduction pathway, also phosphodiesterase is involved because CGMP is involved, right? You can read up the visual transduction pathway, and because it also overlaps in inhibiting that, therefore color blindness may develop, right? I hope Hardik is good with the score. If not, he can speak up. Okay. Now moving on to the next question. Okay. A patient with hypertension and diabetes is taking propranolol to reduce blood pressure. Propranolol is a beta blocker. The patient also takes insulin for his diabetes. His doctor is particularly concerned that he should take insulin strictly as per dose and never skip his meals. Why is the doctor so worried in this case exactly? Your time starts now. What does propranolol cause which makes him worry about his insulin doses. Okay. Only 10 seconds left, but I'll add on 15 seconds more because no one has yet attempted. Okay. Okay. So most of you have attempted, and like that is not the exact reason. Propanolol is a beta blocker. So high. Okay. Mm, I have got messages from Soham, which is also I want Soham you to give me an answer in one box. That is incorrect. Shubhra Jyoti is also incorrect. Bhavya's answer I didn't even get. That one word was not explanatory enough. Okay, Mokshal is, I would want you to elaborate on that. It's yet not correct. Simmer also, I would want you to elaborate on that. And the time's up. Only Mokshal and Simmer have an opportunity to go ahead and make another guess of sorts. And nobody yet has gotten it correct. Okay. So 10 seconds more. Mokshal and Simmer still have the window open. Okay, so I got one from Mokshal, but that is still incorrect. Simmer. Okay, Simmer is taking a long time. I don't know if. Okay, that's about it. So the problem here is insulin, defective insulin take up by varying the concentration and stuff, and not skipping meals and stuff. What it causes is hypoglycemia, and hypoglycemia precedes with sympathetic symptoms, right? So sympathetic symptoms precede hypoglycemia, and the use of propanolol essentially masks those sympathetic symptoms, and therefore the patient goes directly into hypoglycemic coma, and therefore we do not get a pre-hypoglycemic symptoms. So that is insulin needs to be like highly regulated. Okay. Uh, let's move on to the next question. Nobody gets points for this question as well, Hardik. Okay. The next question is: a 2-year-old boy is hospitalized with recurrent Staph aureus abscesses. This is his 4th hospitalization. 2 previous hospitalizations was also with Staphylococcus aureus abscesses, and one was with Serratia pyelonephritis. His parents, sister, and brother have never been hospitalized for infection. The recurrence indicates some vulnerability on the part of the infant's immune system. The infant was finally diagnosed with X, which was due to deficiency of the enzyme Y. Identify X and Y and explain in brief why staphylococci is the most common infection that the infant is contracting. Like ideally, I want all of you to like give uh, entire answers for this, but okay. Subra Jyoti attempted it and is still wrong. If you identify X and Y alone, I'll give you half the points. If you identify the funda, I'll give you full points. Okay, that was not. Soham attempted, and it's I don't know why. What is this X or Y or the funda? What are you hinting at, Soham? Okay, So, Aniket, you gave me the right answer for X, but not for Y. So, I'll give you like a chance to get to Y as well, another guess. Consider it if you answer Y as well as the funda. Mokshal attempted and is incorrect. Okay. Bhavya gets 10 points. Bhavya gets half of the points that would be eligible for this round, not 10. But also you get a chance to attempt the funda as well if you want to get full points. But essentially X and Y, Bhavya got it correct. I'll give you more time if you want to attempt the funda. Soham is incorrect. Soham, Mokshal, and Aniket have given me incorrect answers. Aniket still has a chance to attempt Y and the funda together to get marks. Bhavya gets half of the marks confirmed and still has a chance to get the funda correct. Sara, I got the answer from Sara, which is incorrect. Okay. You have 15 seconds, Bhavya and Aniket, to elaborate on your answer. And it's half of the point. Okay. So Aniket is still not entirely correct on the Y thing. He's very close. Uh, okay. But you do not have any idea about the funda, so therefore Aniket won't be given any marks. Bhavya still has the chance to go with the funda. Anyway, she still gets half of the marks. I'll wait for 10 seconds more, Bhavya, then we are done. Okay, so I did not get any response from Bhavya. Hardik, give her 15 marks, which is like we are not considering anyone got this correct. So 30 minus 2x is still 30, and half of that she got correct. So give Bhavya 15 marks, and nobody else gets anything. Okay.
Okay.
So the answer was she was diagnosed with chronic granulomatous disease due to deficiency of NADPH oxidase, which causes the phenomena of respiratory burst, right? Respiratory burst, you can see it here. And what is special about Staphylococcus aureus is that it is classified under the bacterial class called catalase positive, right? And catalase positive uh, take away this H2O2, degrade that, and therefore HClO is not formed due to the activity of myeloperoxidase, and O2 minus was initially not formed because of the deficiency of the enzyme NADPH oxidase, and therefore respiratory burst is halted entirely, right? So that is the correct answer, and Bhavya gets half of the marks because she identified CGD and NADPH oxidase correctly, right? Okay, we'll move on to the next question. Hardik, you are clear with the scores, right? Just 15 to Bhavya this time. Okay.
Yes.
A patient is admitted with complaints of spasm of the hand and feet and paresthesia at her whole body. Her complaints began 4 hours ago and she had vomited once. She had spasm like twisting in the hand. She reported this when she was about to enter the National University entrance exam. Her personal medical history was unremarkable. She underwent 2 cesarean sections and had 2 healthy children at the ages of 2 years and 6 months. Family history and drug usage history was unremarkable as well. She looked anxious and had flexion contractions in both her hands. Her respiration was fast and deep at 24 per minute. Schwastek finding was positive. Explain the initial presenting symptoms, which were complaints of spasm of hand and feet and paresthesia at her whole body, based on the thorough history that was given or the labs that will be shown to you on the next page. A routine ABG was done on this patient. So first I'll give you 5 seconds, 10 seconds more to read the entire question. That I'll give you the labs, 10 seconds to inspect the labs, and 30 seconds to find the answer, where I'll skip from the history to the labs midway, right? You can read the question now if you want to again, right? These are the laboratory findings, and the red ones are different from the normal values, though you may look at all of them and make your guesses as to what uh, metabolite or electrolyte problem this may possess, and contrast this with the history as well. Okay, you can see at the question again, maybe the labs. Shubhro Jyoti, you are on the right track. You identified one thing. I would want you to elaborate for the entire marks. I'll give you half anyway. This is the history again. Hardik is very much lateral to the topic. I won't give Hardik Bendele marks. Yes, Simar also. Simar and Sara, both of them, you are on the right path. I would want you to elaborate further as to what the symptom presentation is. Aniket also, you are on the exact opposite path as Simar and Sara. You are explaining the symptoms, but look at the labs as well. Correlate the labs with the symptoms. Okay. Shubhra Jyoti gets full marks. He is entirely on point. Sara, Soham, Simar, and Aniket, all of them are currently at half of what the entire marks would bring about. Bokshal is incorrect, and you cannot guess again. Sara, I would want you to elaborate on that, looking at the labs as well. Please correlate the labs with the history. Your time is up, but I'll still give 15 seconds to all the people who are halfway there, but can get marks. Right. Sorry for that. Okay. Okay. Soham gets full marks. Soham and Shubhro Jyoti get full marks, whereas I'll stop taking responses now. Aniket is incorrect. Sara is half correct. Simar also gets half. Right? Yes. Simar also gets half. And Hardik Bendele does not get any marks. Right? Hardik and Aniket don't get any marks. Simar and Sara get half marks. Shubhra Jyoti and Soham get full marks. Sara, I am not accepting responses anyway. That was incorrect. Okay, you are still getting half marks. Okay. So the answer was, as many of you pointed out, some of you pointed out one part of it, some of you pointed out the another part of it. The linking was essential, which would have got you full marks, which Shubhro Jyoti did it perfectly. So the history suggested something of a hypocalcemic symptoms, right? Spasms and paresthesia, and Chvostek sign is almost confirmatory of a hypocalcemic state. But when you look at the labs, calcium levels are normal. So what happened here was a functional calcium deficiency to the alkalosis that was caused due to two reasons mainly. The one that she vomited, and one that she was about to enter the national level university exam. So therefore, she was anxious and was breathing really fast. Right. This was the entire answer that I expected. Shubhro Jyoti did it perfectly, and therefore this is a some people got one part of it correct. That was the hyperventilation syndrome. The other people got functional hypocalcemia correct. So I guess the whole concept is clear now. And I am also assuming that Hardik got hang of the scores, which were really complex this time around.
Yes.
Okay. So now we'll move on to the next question. Ornithine translocase is an important part of the urea cycle pathway, which is essential for transfer of ornithine from the cytosol to the mitochondria for ornithine transcarbamylase, a mitochondrial enzyme, to act on it. Right. So deficiency, this means ornithine translocase, causes a disease known as HHH, hyperornithemia, hyperammonemia, and homocitrullinemia syndrome. Right. One of whose symptoms, as you can see, is increased homocitrulline in blood. Give the funda why homocitrulline level increases in this syndrome. How is homocitrulline level related to the enzyme deficiency at hand? Yes, time has started. 15 seconds left. I haven't got any responses. How does the increased homocitrulline level correlate with the enzyme defect here, which is a part of the urea cycle, ornithine translocase deficiency? This is a really common syndrome, the triple H syndrome. 15 seconds more because nobody has yet attempted. Also reminding you that there are no negative marks for this round. So you better yet attempt. Sarah gets full marks. That was okay. Simmer is incorrect. Sarah is gave the exact answer that I was expecting. Hardik is incorrect. I got Hardik's and Simmer's response, which is incorrect. Sarah's response is correct. Bhavya, I also got a response that is also incorrect. How would you explain homocitrulline by that, right? Okay, so I am stopping taking response from now on. Only Sarah got it correct. More people attempted who have got it incorrect, right? Soham, I am not accepting responses now. Okay. Okay. So the funda here is ornithine translocase gets ornithine to the location where an enzyme acts on it, right? The enzyme is OTC, ornithine transcarbamylase. Ornithine, as you will see, entirely resembles lysine except for one methyl group. So when ornithine is unavailable for OTC to act on, lysine is used as substrate by OTC and converted into homocitrulline, which is different again from citrulline by just one methyl group. So what ornithine is to citrulline is lysine is to homocitrulline, and lysine is often utilized by OTC. So therefore, homocitrulline level increases in blood. That's the concept behind this, which Sarah put it absolutely brilliantly in the fewest words possible, right? So I guess Hardik, you are done with the score, right? 28 marks to
Yes.
Sarah. We'll move on to the next question. A 47-year-old male who presents to the emergency department with a 12-hour history of hematemesis. Hematemesis is coughing out blood, right? He had 4 episodes of hematemesis during this time span. He also complains of nausea, fatigue, and lightheadedness. He smokes 1 pack of cigarettes per day. He also drinks 6 to 8 beers per day, with more being consumed on the weekends and holidays. He was drunk to this amount of alcohol for 22 years. He is afebrile. His eyes are slightly icteric. The abdominal examination reveals mild distension and evidence of hepatomegaly. The initial diagnosis was confirmed endoscopically. The initial diagnosis was of the diagnosis that was made of the hematemetic episodes, which was the presenting symptoms. Laboratory data shows hemoglobin was at 9.8, hematocrit at 29, blood platelets at 98,000, INR was at evaluated. What could be the proximal cause behind the initial presentation of hematemesis? Okay, your time is starting now. Hardik Bendele gets full marks. That was right on point. Soham also gets full marks. Aniket also gets full marks. Simar also gets full marks. Sarah's answer is incorrect. I got that, but it's incorrect. You were on the right track, but I wouldn't allow another response. Okay. Mokshal also response I got, but that is incorrect. Just 10 seconds more. Okay, so I am stopping taking responses now. Just for the scorers, Hardik Bendele, Soham, Aniket, and Simar have got it correct. 4 people have got it correct. I'll repeat: Simar, Aniket, Soham, and Hardik Bendele have got it correct. So the concept here was, as you can see, the entire history is suggestive of liver failure, because he was alcoholic for 22 years with heavy consumption of alcohol, and he was icteric and abdominal distension, ascites, like even hepatomegaly. Everything was, even the liver enzymes were elevated. So this is giving an indication towards liver failure, which caused portal hypertension and therefore esophageal varices, which burst and caused the hematemetic episode. Sarah, I am not accepting answers right now. Though yes, it was overt upper gut bleeding, but this correlation with the history was what was important, right? So that is the portal hypertension due to chronic alcohol abuse caused esophageal varices with just burst to give the hematemetic episode, right? I hope the scores are clear and everybody is okay with the concept, right? Okay. So, well, moving on to the last question of this round. Uh, okay. So, Ronaldo presents to the emergency after a collision with Messi, while both were vying to head the ball, right? Ronaldo fell down immediately and lost consciousness on the field. The paramedics took a few minutes to arrive, by which time the patient had regained consciousness. He insisted on finishing the match and went on to score a goal by the end of 90 minutes. 6 hours later, his girlfriend has brought him to your emergency. She tells you that while they were celebrating his goal, he developed headache, became drowsy, and became unconsciousness. On examination, you see a small swelling on the scalp on the left temporal area. You immediately order a CT. What findings are you expecting on a CT? So this really, these are the 4 options for the CT. Ideally, the answer includes one of these 4 and the diagnosis. What diagnosis would you get from the history as well as the CTs, right? But I'll give you half of the total calculated marks if you give me the diagnosis, but giving me the CT alone would not give you anything, right? Okay, your time starts now. I'll show you the. Okay, Shubhra Jyoti gets it correct. Mokshal also gets it correct. For the diagnosis part, I'll give you the CT as well. Simar, you'll have to give me the diagnosis at least. I wouldn't consider the CT till your diagnosis is correct, and give me one message with both the answers, everybody. Okay. Hardik also gets the diagnosis correct. Hardik Bendele, Mokshal, and Shubhra Jyoti have got the diagnosis correct. No response on the CT yet. Bhavya has got it incorrect. I have got your message, but it's incorrect. Simar is also incorrect in the diagnosis part. Sara is also incorrect. Simar, as I said, is incorrect. Aniket is correct on the diagnosis part, whereas he's incorrect on the CT, so he'll get half of the marks. Mokshal, I think you got the diagnosis correct. Now you'll have to give me the CT finding. Hardik CT finding is incorrect, but he gave me the diagnosis correct, so he gets half. Okay. Soham's also CT finding is incorrect. Shubhra Jyoti's entire answer is incorrect. You to give Soham's diagnosis is correct, but but the CT finding is incorrect. So I am stopping taking answers now. Nobody has given me the whole answer correct, but multiple people have got the diagnosis correct. I would repeat who have got the diagnosis correct. So Aniket has got the diagnosis correct. Soham has got the diagnosis correct. Hardik Bendele has got the diagnosis correct. Mokshal has got the diagnosis correct, and Shubhra Jyoti has got the diagnosis correct. So I guess 5 people have got the diagnosis correct. So you can give like 25 over 2, like 12 marks essentially to all 5 of them, and the rest do not get any marks.
I think the mistake that they might have done in the CT would be the side, left or right.
Yes, mostly. So the guy that just spoke up is the creator of this question. Okay. Let's move on. I guess the Hardik, are you clear about the scores? 5 people. Do I need to repeat the names again? They all get 12 points each.
I will tell the scores. एक मिनट पूरे राउंड के scores बताता हूँ. फर्स्ट राउंड के scores बताता हूँ. जब तक सेकंड राउंड के
Okay. So I'll give the answer first. So this was an epidural bleed due to the middle meningeal hemorrhage, right? Middle meningeal artery right at the terion, the temporal region. So this epidural bleed has a characteristic lucid interval wherein the patient is conscious and active, which was uh, illustrated by how Ronaldo picked up and finished the match and even scored a goal. But that collects and gives symptomatology of unconsciousness and presents to the emergency several hours later. So that was enough to give you the indication that this was an epidural bleed. And the correct CT finding was B, where it's the left-sided lens-shaped appearance, which is characteristic of an epidural bleed, right? Left-sided was given in the history, the left temporal area, right? Yes. So the CT finding is B, and the diagnosis was an extradural or epidural bleed due to the hemorrhage of the middle meningeal artery, right? Okay. So before we move on to the next question, next round, Hardik can give out the scores.
Uh, So team 7 is at first with 78 points, and team 8 is second with 56, and team 6 is third with 55. Okay, this is 1, 2, and 3, and then बाकियों के marks. Team 1 32, team 2 35, team 3 32, team 4 30, team 5 41.
Okay.
I'll write it in the chats पूरा completely.
Does anybody want him to repeat the scores? एक बार still Hardik, in order 1 to 8 team numbers scores दोबारा बता दे.
Team 1 32, team 2 35, team 3 32, team 4 30, team 5 41, team 6 55, team 7 78, team 8 56.
Okay. So we'll move on to the round 2 here. Round 2 has 8 questions again, and there are 8 of you. So this will be directed one by one to each one of you according to your team number. Each question is worth 20 points. The pounce window is 30 seconds for each question, and everybody can pounce there. Pounce is worth 20 plus, whereas a negative 10 would be awarded on pounce if you get it incorrect. Everybody who has to pounce has to give the entire question correct. These questions would mostly be divided into parts, and each part would be worth 5 to 10 points, as will be told to you with the question itself. The one who the question is directed to can get part points based on particular parts he gets correct, but the people who are pouncing have to get everything correct, or they'll get -10, right? So if you are pouncing, you have to get everything correct and in one message box in the 30 seconds period. After the 30 seconds, uh, I'll want you to speak up, the one whose the question is directed to, and give me any guesses possible, because there is no negative marking and there are part points. So get as many marks you can from the question that is directed to you, right? You can like read the rules, but essentially that was. Uh, Hardik has also given out the scores in the chat box if anybody is, right. Okay. So I'll direct the first question to Aniket. After I read the question, the timer will start. That required, I'll extend the time for 10 to 15 seconds anyway. Then I'll ask Aniket to speak up the answer or guesses separately for points, because he would get part points, whereas none of the others would get part points for the question directed to him, right? Okay, we'll start with the first question directed to Aniket this time. But every one of you are allowed to pounce as DM only if you are sure of the entire answer, and you can you can bear the negative marks, and you can give me entire answer in the chat in one chat itself, right? Moving on. The first question to Aniket. Valvular heart defects are broadly classified as stenotic and regurgitative, which are particularly opposite effects. Stenosis causes reduced flow during systole, and regurgitation causes backflow, which is the incompetence of a valve, because that's what the valve is here to prevent, right? This information can be used to predict the murmurs associated, at least the intervals with respect to S1 and S2 of the increased afterload due to increased requirement of pressure to push blood through the stenotic valve, whereas regurgitation has increased preload as more blood flows back into the ventricle during the diastole, right? This was the background. Now, this is the question. Identify aortic regurgitation and aortic stenosis by their characteristic murmurs labeled A to F here, and predict the changes in pulse pressure in terms of increased, decreased, or remain same in each, or aortic regurgitation and aortic stenosis. So these are 4 answers. Give me the A, B, C, D, E, F for aortic regurgitation and aortic stenosis, and the change in pulse pressure for both of them. Pounds window starts now, but all of for the pounds people, you have to get all 4 of them correct to get 20 marks, and lose -10 if even one of them is correct. After 30 seconds, it will be pushed to Aniket. He can guess every one of them separately and get 5 marks for every correct answer that he gets. I started the timer now. Ten seconds left. I haven't got any responses yet. Okay, I'll give you 10 seconds more because I haven't still yet got any responses. Okay, so time's up. No pounces. I would invite Aniket to speak up and guess all the 4 that you want to. Aniket?
Hello, am I audible?
Yes, sure. Go ahead.
Okay, so my guess would be aortic regurgitation should be D. Aortic stenosis D. D for dead.
E. Okay, dead. D for dead. Yes.
And stenosis should be B. B for ball.
Okay.
And pulse pressure decreases in both.
Okay. So he gets 15 out of 20. Both of these murmurs were correct. The aortic stenosis gives a characteristic systolic crescendo decrescendo murmur, as you can see, whereas aortic regurgitation gives you a diastolic decrescendo murmur, right? So both of them Aniket got correct. Pulse pressure changes, aortic regurgitation, it's increased, and that is really clinically important because the signs of aortic regurgitation that you will see would be mostly because of the increased pulse pressure. You will see bruit everywhere in the body, right? You will see pulse that is really strong, that is even like audible and visual pulses you will see in aortic regurgitation. So that is really important to know, that pulse pressure increases characteristically in aortic regurgitation, right? So 15 points Aniket gets out of this. Nobody pounced, and so nobody else gets anything, right? So aortic stenosis B and D, and that you can see it. Okay. The next question would be directed to Bhavya. Okay, and I'll read the question, then again 30 seconds for everyone else, and then Bhavya will speak up the answer or guesses, whatever. Okay. So cranial nerve nuclei in the brainstem and otherwise can be thought of as a junction between the upper motor neuron and the lower motor neuron. Laterally to cranial nerve nuclei on both sides. Therefore, upper motor neuron lesions due to strokes rarely so result into complete dysfunction of the cranial nerve activity, right? Lower motor neuron, on the other hand, generally projects only ipsilaterally and therefore are the most common cause of presenting cranial nerve lesions. The former generalization, which I would repeat, was that upper motor neurons project bilaterally, breaks down for 2 nerve nuclei, X, and a part of cranial nerve nuclei is Y. This exception is of immense clinical importance. The latter generalization, which was that LMN project ipsilaterally only, breaks down for 2 more nerve nuclei, a part of cranial nerve, the former generalization broke down for a part of X and a part of Y, right? The latter generalization, that lower motor neurons project only ipsilaterally, breaks down for cranial nerve of T. Identify X, Y, Z, and T. As you can see from the question, X and Y are exchangeable, right? X and Y have 2 answers, but they are not specific for X and Y. X and Y are just parts, both are parts. whereas Z and P are specific because Z, the entire cranial nerve nuclei does not follow this generalization, whereas P, only a part of it does not follow this generalization. For pounds, you will need to be correct in all 4 of them. Whereas after I start the timer and 30 seconds are up, I'll project it to Bhavya, who will give me guesses for any one of them that she knows, right? I am starting the time now. X and Y are exchangeable. You can give me 2 answers for X and Y, and then a specific for Z and a specific for P. I hope the question was clear. The question made 2 generalizations about cranial nerve nuclei, and they gave exceptions, 2 for the first generalization and 2 for the next next generalization. We will cranial nerve nuclei are we talking about? A part of X, a part of Y, the whole cranial nerve nuclei is Z, and a part of P. I realize that answering all of them correctly is a bit difficult in this case, and I haven't got any bounces to give me an indication of that. I'll give you 10 more seconds for even Bhavya to take care of her thoughts and anybody else to attempt, maybe. Okay. Now I would request Bhavya to speak up and give me as many answers as she knows. And maybe guess anything, right? Because there are no negative marks for her and part points also apply.
Hello.
Yes, yes. Go ahead.
X could be facial nerve. Y
Okay.
could be glossopharyngeal, and Z and P also. I would
Yes,
like to
Y
go
could
for
be.
the same.
I didn't get the Y.
Glossopharyngeal.
What glossopharyngeal, okay. And Z and P?
I don't know.
Just an informal tip to you, are not getting any negative marks and there are only 12 cranial nerve nuclei.
Vagus and ninth nerve, cranial.
Vagus for Z and P?
Glossopharyngeal.
Okay, glossopharyngeal. So she gets 5 out of 20. X was correct. Facial nerve, as we all know, the characteristic lower motor neuron and upper motor neuron palsy, right? Upper motor neuron palsy only presents to the lower part of the face. That is because the part of the facial nerve supplying the lower face part does not follow this generalization. So X can be facial nerve, whereas Y is the hypoglossal nerve, and specifically the part of the hypoglossal nerve which supplies the genioglossus, right? The genioglossus therefore is affected, and the tongue deviation can be a sign of upper motor neuron lesion, right? Z was trochlear nerve. As we all know, trochlear nerve decussates just behind in the dorsal part of the brainstem, right? It's the only nerve that originates from the dorsal side and decussates. Therefore, the nucleus on the left projects to the right side and vice versa. So Z is the trochlear nerve, whereas P is the oculomotor nerve, and specifically the part that supplies the superior rectus. This is something that is not really common, and I don't know if it's clinically important. I haven't found a clinical use of it yet, but all of the other are like really important stuff that you should know, right? So she gave the correct answer for facial. All the rest of the 3 she got it incorrect, so she gets 5 out of 20, right? And nobody else found, so nothing for anybody else. Now, I guess the concept, whatever little was involved here, is clear. Now, the next question would be directed to Hardik Bendele, right? Again, the things remain the same. I read out the question, 30 seconds or so for pounds, and then I'll project it to her. Okay. So the next question for Hardik, posture, gaits, and specific muscle weaknesses can give the physician a clue into where might a lesion due to an ischemic stroke, let's say, be located. While analyzing these kinds of clinical signals, one must be aware of the differences between upper motor neuron and lower motor neuron lesions, the functions of different pyramidal tracts and extrapyramidal tracts, function of different nerve nuclei, position of different tracts, fasciculi, lemnisci, and compensatory movement changes in response to the inability to move a particular muscle. The above image, the image shown here, demonstrates one of such common presentations. It has been found to be due to a stroke or an infarct in the X area of the brain, which is supplied by the Y artery. You will need to be specific about the X area. The Y artery, I'll still accept some vagueness there, but about the X area, you have to be specific. The symptoms, as you can see, is lower facial weakness, upper limb flexion, lower limb extension, and circumductory gait. Right? Explain all of these four symptoms by a stroke in a specific area X and supplied by an artery Y, which must be involved in the stroke. Right? I hope the question was clear. I'll start the timer now. 30 seconds for anybody to pounce. For pounce, you need to be correct on both these fronts. Whereas I'll pitch it to Hardik Bendele after. Okay, so I have 10 seconds. I'll give more. Then I'll pitch it to Hardik. Okay, Hardik, I want you to speak up any guesses that you might have for area X supplied by artery Y.
Hello.
Yes, you're audible. Go on.
So seems like decorticate rigidity.
Okay.
I don't remember the exact area, but it must be above the level of red nucleus.
Okay, so you'll need to be more specific in this regard. I wouldn't be able to award you marks just for this. Though the identification of a decortical rigidity is a really good step towards getting the answer correct. I can give you one more guess if you want for the area X to be more specific about it. Are you willing to take it?
Yes.
Go ahead.
Between two colliculi?
Between the two colliculi? No. Okay. So I don't know if area X does not get there. Probably the Y artery is irrelevant anyway. So the answer for this is, as you rightly pointed out, decorticate rigidity. So this of decorticate rigidity present with spokes in the internal capsule, right? So internal capsule could have been predicted by as you might have done yourself, upper limb flexion and lower limb extension, which are characteristic of decorticate rigidity, right? Then combine that with lower facial weakness that represents an upper motor neuron palsy of the facial nerve, right? And the corticobulbar tract, which goes through the genu of the internal capsule. So the infarct can be localized by these two things: the facial weakness, the upper motor neuron facial palsy, and the decorticate rigidity to the genu of the internal capsule. The genu of the internal capsule is supplied by the striate arteries, which are branches of all the major arteries in the brain: the anterior cerebral, the middle cerebral, and some direct branches from the internal carotid. Right. So the correct answer was the genu of the internal capsule. So no marks would be awarded for this because I guess Hardik is okay. Next, moving on to the next question. Again, the format remains the same. This time, the question will be directed to Mokshal. Okay. So moving on to the question. The deep cervical fascia of the neck condenses to form number of layers which divide the neck into different compartments. Neck infections can cause abdominal pus discharge, which extends in various directions along the extent of the facial layer. These infections can spread inferiorly into the mediastinum. Now match the cause of the infection and the inferior most compartment of the mediastinum it can spread to, keeping in mind the inferior attachment of various layers of the deep cervical fascia. Right? So here are three sites of infections, and here are three inferior most extents. You'll have to match each of them. This does not have specific part points even for Mokshal because part points does not make sense in this question. So both for the pounds people and for Mokshal, you have to get it entirely correct for 20 marks. But for the people who pounds, there is a negative 10 for not getting it correct. But for Mokshal, it's like a guesswork because there is just 20-0. I'll start the timer now. For pounds, you'll have to get all correct, right? Match the site of infection and the inferior most extent to which the infection can travel. Okay, so Bhavya has attempted the pounds and is correct. So she gets 20 marks. Shubhra Jyoti has also attempted the pounds and is also correct. Shubhra Jyoti and Bhavya get marks for this, 20 marks each. And the time is also up. So now I'll ask Mokshal to speak up and give his guess.
Okay. Am I audible?
Oh, sorry.
Am I audible?
Shubhra Jyoti attempted incorrect. Yes, sorry. Shubhra Jyoti gets -10, whereas Bhavya was correct. Sorry, there was a mistake there. Shubhra Jyoti gets -10, whereas Bhavya gets +20. Sorry for that. Mokshal, I would want you to guess.
Okay. Am I audible?
Yes.
Yeah. So A would be second.
Okay.
B would be third.
Okay.
And C would be 1.
That is incorrect. So Mokshal does not get any marks. Shubhra Jyoti gets -10 and Bhavya gets +20, right? So the answer is A3, B2, C1. So this one would be very obvious and nobody seemed to have gotten it incorrect. C is obviously 1 because the C laryngeal would obviously go down to the anterior mediastinum. A and B seem to be a bit tricky. This is because of the extension and connection of the alar fascia layer, right? So it connects posteriorly. So the anterior layer gets through to the posterior mediastinum, whereas the posterior layer stops at the superior mediastinum, right? So the tuberculosis of cervical vertebra, because it's behind the alar fascia, it will only get to the superior mediastinum, whereas the infection of the retropharyngeal lymph nodes will extend to the posterior mediastinum. Therefore, it's also called the quote-unquote danger layer, as they say. Okay. So I hope the score is also clear. Shubhra Jyoti gets -10, Bhavya gets 20, and Mokshal does not get any point. Right? Okay. So the next question would be directed to Sara. And again, the concept remains the same, right? So here is the question. Strokes are one of the most common emergency conditions when time is of the essence. Often TIAs, transient ischemic attacks, when suspected, have to be distinguished into two forms, ischemic and hemorrhagic, through a non-contrast computed tomography. This distinction is important as the mainstay therapy for ischemic strokes is X, which is absolutely contraindicated in hemorrhagic strokes. Often the defects produced by strokes are attributed to a phenomena known as excitotoxicity involving the channel Y. So you have to give me X, which is the mainstay therapy for ischemic strokes, which is contraindicated for hemorrhagic stroke. Therefore, the differentiation is absolutely important. And the phenomena excitotoxicity is caused by which channel Y. The Pounds window starts now. And for you to get the Pounds correct, you'll have to answer X and Y both. Then I'll pitch it to Sara for guessing either one if she gets it correct, right? So again, X is the therapy for ischemic stroke, which is contraindicated in hemorrhagic, and Y is the channel which causes the phenomena called excitotoxicity, which is the main reason why strokes are supposedly like emergency conditions with. Okay, so 10 seconds left. I haven't got any bounces yet. Okay, so now it's open to Sara to speak up any of X or Y if she knows them, or make guesses for all it's worth because there are no negative points.
Am I audible?
Yeah, sure. Go ahead.
X would be recombinant tissue plasminogen activator injection. That is IV injection of TPA. Okay. And
TPA.
Y
okay.
would
Okay.
and Y would be NMDA receptors.
Okay. So that is like she gets full 20 marks. That is exactly what I was expecting. So fibrinolytics TPA, like that is the mainstay therapy for ischemic stroke, so that you break up the embolus or whatever is causing that ischemic stroke. But of course, if you go towards anticoagulation by improving the fibrinolytics, you will cause more aggravation of the hemorrhage if the hemorrhage was the one causing the stroke, right? And excitotoxicity, as we all know, is due to the NMDA receptor and the calcium channel that it involves, right? Due to excess calcium intake, excess calcium in the cytosol triggers breakdown of proteins and stuff, and is essentially the culprit behind all the bad stuff that is related to strokes.
Okay, thank you.
So nobody attempted the pounds, and Sarah gets full 20 marks for this because she got both of them correct, right? Now I'll be moving on to the next question. Next question would be directed to Simmer, right? Again, the method remains the same. So the next question. Collagen forms the basis of all connective tissue. It has different forms based on different types of genes involved, which may cause defects in bone like osteogenesis imperfecta and cartilaginous growth like Ehlers-Danlos syndrome. Often patients presenting with bleeding in urine, later diagnosed as glomerulonephritis, and blood while coughing have associated basement membrane collagen deficiency, right? Defective collagen which is present in the basement membrane. Which type of collagen is present in the basement membrane? And name the condition due to mutation in the gene producing that type of collagen, and where and a syndrome where the antibodies targeting it are produced. So X, Y, Z are the type of basement membrane, Y is the condition due to mutation in the gene producing that type, and Z is a syndrome where antibodies targeting it are produced. Pounds window starts now. If anybody has to pounds in 30 seconds, give me all three of them, and then I'll later pitch that to Simmer. Ten seconds left, and I haven't got a bounce yet. Okay, so we close the pounce window. Simmer, you are invited to speak up. Anything you know. By the way, marking for this round for Simmer is 5 for each and 5 bonus if she gets all of them correct, right? So.
Hello.
Yes, Simmer.
Am I audible?
Yes. Go ahead.
X is collagen type 4.
Okay.
Y, the gene is Pol4A.
No, I don't want the gene. I want the condition due to mutation in the gene. Right? The syndrome associated with mutation in the gene. The question was clear, right? Name the condition due to mutation in the gene producing it. I'll give you another chance to to give the condition if you want to. The condition, if you know, that was associated with the mutation in the gene producing whatever type of collagen is present in basement membrane.
Glomerulonephropathies.
And that is a presentation, right? There's a syndrome which has an eponym associated. Glomerulonephropathy, glomerulonephritis would be the presentation of any basement membrane collagen defect, as we saw in the history itself, right? So you can skip, of course, if you not sure, right? Maybe Z. You've answered X. You still have a chance to answer Y and Z. I need you to respond.
Y, Alport syndrome.
Okay. And Z. You can't be taking time like this.
I don't know.
Okay. So she gets 10 points for giving Alport syndrome and collagen type 4. Z is called good pasture syndrome. It is when antibodies targeting collagen type 4 are synthesized, and it presents almost similarly to Alport syndrome because essentially it's the defect in the basement membrane collagen type 4, right? So X is type 4, Y is Alport syndrome, whereas Z is Goodpasture syndrome. I hope the answer is clear, and Simmer gets 10 points for this, whereas nobody else, I guess, found yes. So we'll move on to the next question. Simmer gets 10 points. Now, the next question would be directed to Soham, right? The rules remain the same. Moving on to the next question. Parkinson's disease, a neurodegenerative movement disorder that leads to shaking, stiffness, and difficulty with balance and coordination, is due to insufficient production of neurotransmitter X as a result of idiopathic loss of the respective neurotransmitter producing cells in the brain. The most common treatment of Parkinson's is administration of a precursor Y, which is usually given along with another medication Z that reduces the side effect of Y by reducing its peripheral metabolism. Identify X, Y, and Z. Also, which one among them can cross the blood-brain barrier? For pouncing, you'll need to Hardik Bendele. You'll need to give me one message with all of this, right? I am starting the pounce window now. You'll need to give me all correct if you want to pounce, and then the question will be directed to Soham. I have not yet accepted Hardik Bendele's answer. I'll need you to give me the answer, whole answer in one big message. Shubhro Jyoti has pounced and has got it incorrect, so plus 20 to him. I am not yet considering that Hardik Bendele replied to me, so he'll not yet get minus 10. But if you want to, then you will have to give me one. Okay. Mokshal, you have just given me, you have left out one part of the question. If you still give me the answer, I'll give you plus 20. Otherwise, minus 10 is there for you. Okay. Bhavya has also pounced and has gotten it correct. I have stopped the pounce window now, but Mokshal still has the chance to answer the second part. Okay. Mokshal has gotten it correct. Sorry, Sara, I would not be able to accept that answer because the pounce window was over. Mokshal gets it correct. Bhavya gets it correct. And Shubhra Jyoti gets it correct. Hardik Bendere, I am not yet, I have not considered he even answered the question because it was too early and he breaked out in its parts. Right. Now the question is for Soham. You can speak out and give me as many answers as you have.
Hello.
Yes. Go ahead.
X will be dopamine.
Okay.
Y will be levodopa.
Okay.
And Z will be I guess carbidopa. And levodopa will cross the blood-brain barrier.
Okay, so Soham also gets 20 points. Every one of them was correct, and I don't even need to explain the answer now because that was the ideal answer. Soham also gets it entirely correct, and you know why? Because if carbidopa would also have crossed the blood-brain barrier, then it would have decreased the metabolism of L-dopa even inside the brain. So essentially, that's the concept behind combining carbidopa with L-dopa, right? So that it stays in the peripheral circulation and decreases its metabolism there, thereby preventing nausea and other side effects of L-dopa in circulation. And when the L-dopa crosses the blood-brain barrier, it gets converted into dopamine, thereby facilitating correction of Parkinson's. Okay. Now we'll move on to the next question. Hardik, are you clear on the scoring on this one?
Yes.
Okay. Now we'll move on to the next question, which would be directed towards Shubhra Jyoti, right? Okay, the rules essentially remain the same. Okay. Now moving on to Shubhra Jyoti's question. This is the normal Darrow-Yannette diagram, which shows ECF and ICF volume approximately 1:2 ratio normally on the x-axis and height as the osmolality of the fluid in them. All the change, pathological or physiological, start from the ECF, and because of being an osmotic equilibrium with ICF, affects it, right? So this is the Darrow-Yannette diagram. Here, I would want you to see that the brown area is the original thing, and the shaded line is the new condition after a certain modification has been done on it, right? ECF and ICF generally 2:1 in ratio, and most of the changes start off in the ECF, right? Now here are 4 conditions. Then there are 6 diagrams. I would want you to match each one of them with each one of them, right? For pounds, you'll have to get all of them correct. Shubhra Jyoti can get any number of them and also answer every one of them in one message box. I'll give you enough time if you guys want. I'll give you extra time for this, but give me the whole answer in one box, right? I'm starting the pounds window now. Okay. For the people who are pouncing, give me entire answer in one box. If you give me half of the answer or even one part of it incorrect, you get a -10. And Shubhra Jyoti can attempt every one of them separately with part marks. As I said, the dotted one is the new thing, and the shaded one, the colored one, the brown colored one is the original thing, right? This should be clear. I'll give you 15 seconds more, but just because I feel typing, but I haven't received any pounces yet. Okay. So 5 seconds more maybe. Okay, that's about it. I haven't got any pounces. I would invite now Shubhra Jyoti to speak up if he knows any of these answers.
Hey, am I audible?
Yes. Go ahead.
Am I audible?
Yes.
That is infusion of 5% dextrose would be D. Blood donation would be C. Aldosterone X.
A letter, a word with it so that it's not confusing, just like Aniket did. I'm
okay. So
first one.
Okay. So 1 would be D, and D is for Delhi.
Achha, 1 is
2
D
would
for
be
Delhi.
C. Okay. C for cat. 3 would be E.
Okay.
E for east.
Okay.
And I'm not particularly sure about D. 4 would be A for America.
Okay, so I don't know how, but you have got all of them incorrect, right? So the answer to this is DECF. Do you guys want me to explain it in brief why this is the answer and how would you approach this? Like essentially, as I mentioned in the question itself, all of the things start off in the ECF. So first you have to think about what is the osmolality and volume change in the ECF, right? So first think about is the fluid gain happening or a fluid loss happening, and then through the osmolality change, bring out what is the kind of fluid change that is happening, right? Is it a hypotonic fluid change or a hypertonic fluid change? Then when you have the ECF thing done, I just equilibrates with ECF acutely in terms of osmolarity, and volume is irrelevant here, right? So just look at the volume of ECF and the osmolarity of ECF, look at what kind of fluid infusion or exfusion was there, and then match them. Dextrose is a resuscitate, it's a maintenance fluid, and therefore it acts like a hypotonic fluid. Blood donation is isotonic fluid loss. Aldosterone acts by taking in increasing the absorption of sodium, and therefore also increases water. So it's kind of like isotonic infusion, right? Isotonic fluid intake. And sweat is always hypotonic because sodium and chloride are absorbed in the tubules when isoosmolar stuff is going through tubules. So sodium and chloride are taken in, and therefore sweat is always hypotonic. And so you just match them with what happened, and then you can get with the diagrams that are associated. So nobody pounced correct. So nobody got any marks for this round, for this question, right? Hardik has given out the scores at the end of round 2, but Hardik, I would want you to speak them out again for the audience that is on YouTube.
Yeah, so team 1, Aniket is at 47, team 2, Bhavya is at 80, team 3, Hardik is at 32, team 4, Mokshal is at 50, team 5, Sara is at 61, team 6, Simar is at 65, Team 7, Soham 98, and Team 8, Shubro is at 66. So
okay, so also at the start of this round, it was mentioned that one of you, the last one, would be eliminated by this round. So Hardik, team number 3.
Hardik here is Hardik Team 3. So he'll be eliminated because he is at the lowest score of 32.
He would be eliminated at this point. But Hardik, we invite you to watch the rest of the game on YouTube or whatever you think like. I don't know. Next round would be connect. This would be a really swift round. Right? I would give you 15 to 20 seconds for each connect and then direct it to whoever it's been directed to. Right? Essentially, the points remain the same as the directed round, plus 20 and 0 for whoever it's directed to, and plus 20 and minus 10 for everyone who pounces. The time limit is really less here. It's 15 seconds. Depending on the response, I'll increase it wherever required, but take it that will be mostly 15 seconds only. Right? You'll have to pounce by giving me a DM. I can ask you to elaborate after the 15 seconds are over if you are getting to it. Right? Only those who have given me an indication of a sort of correct response in the 15 seconds will get the time to elaborate, and then it will be directed to whoever it's being directed to, right? And we'll follow the same exact team 1 to team 8 thing with just skipping Hardik there, team 3, right? Okay. So the rules of the round are clear. They are essentially the same as the directed one, just it will be swift here from now, right? Okay. So I'll give you the first question. I'll not speak as I've been speaking a lot till now, right? Just get you the question and then tell you to elaborate as and when required. This is the first question. Okay. So Mokshal and Shubhrajyoti have given me Pound's answers, which are explaining a couple of the connects, but the thing with connects is you have to explain every one of them. And this is a pretty vague answer. But it's still towards the point. So I'll not give them minus 10, but you aren't getting any marks either. Right? You have given me the same answer. You have given me fetal alcoholic syndrome. I would want something specific. Okay. Now the question is directed to Aniket. I would want you to speak up and give me a guess.
Okay, so I hope I'm audible.
Yes. Go on.
Okay, so the first picture shows the mother who is drinking
you don't have
alcohol.
To explain like that's just
cool. Great. So
just give me an answer,
alcohol.
then you can explain it for everybody if it's correct. Obviously.
Okay, so I think it's a tetralogy of fellow because the mother is drinking alcohol, which is a risk factor. It's a cyanotic heart disease, so there is clubbing of the fingernails, and the baby is also showing sinuses in the periphery. Yeah, and the third picture is essentially what it is because there's an overriding
which is kind of like the presentation of tetralogy of fellow. Tetralogy of fellow is the correct answer here. So Aniket gets the whole 20 marks here, and as he quite rightly explained, it's a cyanotic condition and it has risk factors, which is the mother being alcoholic and stuff. You can also see the cyanotic baby. You can see he is in a squatting position, which is particularly helpful because the femoral squint, the femoral artery gets kinked, and therefore the left ventricle after load is increased. So left to right shunt is preferred with respect to right to left shunt, which is the one causing the cyanosis, right? So that's about it. Tetralogy of Fallot is the correct answer. And Mokshal and Shubhrajyoti, I'm still not giving the minus 10, but another disclaimer here. For the connects, you need to explain every one of them. I just want the connect. I do not want the explanation. Even Aniket giving the explanation was a bonus here, not awarded with marks anyway. But I just want to connect from now on, right? And that's right. Okay. So 20 for Aniket. Now the next question will be directed to Bhavya, right? So here's the question. The pounce window has started. Five seconds to go. I still haven't responded. There is gotten any bounces. Okay. Mokshal, I have got a response and that is correct. So Mokshal gets plus 20 on the pounce. The pounce window is now over and I invite Bhavya to make a guess.
Composite muscles.
Okay, what do you mean by composite muscles?
Receiving innervation from two different nerves.
Okay. I'll give you that. Plus 20 to Bhavya as well. These are, they can be called composite, hybrid. There are several names. I just wanted to, get to know what does it mean and if you know the concept enough. So it is innervated by multiple nerves. If you really want to, you can like get to which muscles these are. This is digastric, the trapezius, and this this is the biceps femoris, and this is the flexor digitorum superficialis, I guess. Okay, yes. So that is the answer. Hybrid muscles and more than one nerve supplying it. Mokshal gets plus 20 on the pounce, and Bhavya gets plus 20 because it was directed to her, and that was the correct answer. Right. Next question will be directed to Mokshal, and again 15 to 20 seconds for the pounce, and then we'll invite Mokshal to speak up. This is the question. One specific word is enough for this one. 5 seconds. No pounces yet. Okay, I have got a pounce from Shubhrojyoti Mandal, which is correct. I am close. Okay. Soham also I have got a pounce, which is correct. Aniket also I have got a pounce, which is correct. And now I'm closing the pounce window. Right? 3 people have got the pounce correct. And now the question is directed to Mokshal. Mokshal, speak up.
Okay, so there's a deficiency of GnRH because GnRH secreting the neurons, they travel from the nasal epithelium up to the brain, and so that would present with all of these symptoms.
Okay, so the Kalman syndrome, which is essentially what you described. So I'll give you marks for that because essentially the names are not that important anyway. So Kalman syndrome is the answer, which is as you described, is because of GnRH deficiency, because the hypothalamic neurons that secrete GnRH migrate to the same path as the olfactory epithelium, right? So presenting with anosmia and hypogonadism at the same time. So 3 people got it right on the pounce: Shubhrojyoti, Soham, and Aniket. And Mokshal got it right on the direct. Right. So Kalman syndrome is the answer. The next question would be directed to Sara, right? And I'll show, and then 15 to 20 seconds. This is the question. Five seconds left from the pounce window. Okay, nobody pounced. Now I would invite Sara. Pick up. Give me a guess.
Am I audible?
The pounce period was over. Though, yes, Sara, you can go ahead, speak up.
I would guess umbilical syndrome or umbilical hernia.
Okay, so that's the connect according to you. I cannot award marks to that. Umbilical hernia, as you said, is kind of like one of the image. The
Marden syndrome. Okay.
No. Okay. The answer is Down syndrome. It's like a ventricular defect transfers, crease on the hand, and the distance between this is sandal toe distance, whatever it's called. Then there's Mongolian facies and the hernia that you talked about. Down syndrome is the answer. Shubhrojyoti and Soham have given me the right answer, but they are after that pounce window was over, so I would not credit them. No -10 either, because you did not answer in the window that was supposed to be for the answering. So nobody gets any marks for this, not even negative, not even positive. Down syndrome was the answer, right? Okay. Hardik, are we clear with the scoring? Up to yet? Till yet?
Okay. Yes.
Okay. So our next question would be directed to Simmer, right? Again, the method remains the same. This is the question. The pounds window has opened. Okay, 5 seconds left. Okay. I have got only okay, 2 pounces I have got. One is Bhavya, which is correct. Second is Shubhra Jyoti, which is incorrect. So Bhavya gets plus 20, Shubhra Jyoti gets minus 10, and Simmer can speak up a guess if she has one.
Hello, am I audible?
Yes. Go on.
Wilson syndrome.
Which one?
Wilson.
Okay, Wilson. No, it's not Wilson syndrome. I guess if it had been Wilson, we would have somehow hinted at copper or something. I don't know. So this is Gaucher's, rightly guessed. The main thing which we would want you to see was that this was a lysosomal deficiency. We would not have expected that you would have guessed this molecule by looking at it, but lysosomal deficiency, and because enzyme replacement therapy was given, so also that indicates a lysosomal disease. And then this is the crumpled paper appearance, which is characteristic of Gaucher's, right? That is the real giveaway here. Bhavya has gotten it correct, and Shubhra Jyoti has gotten it incorrect. Bhavya gets plus 20, Shubhro gets minus 10, and Simmer gets 0. Okay? Gotcha. Now I will move on to the next question, which would be directed to Soham. Right? Again. Connected. Pounds window has now been opened. Ten seconds left. 5 seconds left. Okay, so I got no pounces up till yet, and the bounce window is now over. Now I would want Soham to speak up. Any guesses if he has one?
I'll go with Wilson's disease.
Okay, I would really love to help get a an explanation for that, but now is not the time. So this is the carotid cavernous syndrome. So essentially the pathology is that, as we all know, the cavernous sinus has as its one of its components the internal carotid artery. When the communication between them occurs, that is an arteriovenous fistula, so to speak, has been created. It creates a pulsating exophthalmos, right? Because of the huge pressure difference between the internal carotid and the cavernous sinus, there is the eye pops out with the pulse. So that's the pulsating exophthalmos due to carotid cavernous syndrome. And because of all the nerves involved, the oculomotor, the abducens, and various other nerves which are part of the cavernous sinus, its walls or otherwise, they cause effect in eye movements, and therefore diplopia, which is indicated in the rightmost image. Right, diplopia, and the cavernous sinus is indicated. The pulsating exophthalmos is indicated in this CT, and this is the angiograph which shows that the carotid has burst and the blood has leaked out. Right, this is the digital subtraction angiography of that. Okay. So for this question, nobody gets points. Right, moving on. Carotid cavernous syndrome was the answer. Right, the last question for this round, it will be directed to Shubhro. Again, let's go ahead. This is the question. The pounds window is now open. Yes, Bhavya, your last answer was not considered anyway because it was after the pounds window. The pounds window at this time is open for this question. Okay. The pounds window is about to close. I have got 2 answers. The pounds window is closed. So again, Soham and Mokshal have given me the answers which represent only a single image, and therefore I would at this point have to give them -10 because the connect is not being explained. And I would invite Shubhro Jyoti to have a guess as to what.
Expedition syndrome.
What?
Expedition syndrome.
Your voice is not clear.
I think we can ask him to
Please give me the chat.
I think we can ask him to put it in the chat box. There's some disturbance in
Am I
the
audible?
voice.
Bro, you can
Bro,
mute
you're
your
audible,
mic.
but there's some disturbance along coming on your mic.
Okay, so I am waiting for Shubhro to give me an. Okay, Aniket, I would not consider this answer because it's after the. Okay, so even Shubhro got it incorrect, but he does not get a negative. And Aniket, I haven't even considered the answer because it was after the pounds window. Anyway, it was incorrect. So the answer here is all. There are 3 syndromes being represented here. All of them have a connect that all of them are associated with triplet repeats. The first one is Huntington's chorea, which is this is a character in House MD. She was named 13, right? She had Huntington's chorea. The second image gives myotonic dystrophy. Third image is supposed representation of Fragile X syndrome. So some of you gave me Fragile X and Huntington's separate answers. I would not consider them because again the connect is supposed to be explaining the connect, right? So Mokshal and Soham get a -10 here, and nobody gets a positive mark. With this, we have to end this round as well. Triplet repeats was the connect, Huntington, myotonic dystrophy, and Fragile X syndrome. And Hardik has put out the scores. And again, we'll have to eliminate one of you. Hardik, can you please speak up the scores in order? Maybe this time include the name of the participants to like feel more personal.
Okay. So Aniket is at 87, Bhavya is at 120, Mokshal is at 80, Sara is at 61, Simar is at 65, Soham is at 108, and Shubhro is at 76.
Okay.
So the lowest thing here is Sara at 61. So Sara will be eliminated, and first is Bhavya for now at the end of round 3.
So Sara, which is team 5 at 61 points, so that's the lowest score and would be eliminated as of this round. Thanks for participating, Sara. You can continue watching on YouTube, right? We'll continue with the next round, which is named Mega Connect, which you just gotten out of Connect. So let's mega this stuff. So Mega Connect,
Okay,
I'll essentially. Okay, thanks. I'll explain to you what the concept behind this round is. So there will be 5 questions pitched to you that would essentially be normal questions, which would not be directed to anyone. Anybody can attempt without without any. It was similar to the differential round. You'll be given a window wherein anybody of you can attempt, and there it will not be directed. And all those 5 questions which have a separate answer, but all of something greater than themselves, right? Each one of you has one guess as to what that great thing can be. That one guess you can use at any moment in the 5 questions after any one of those questions. But personal experience is that you should wait, right? Obviously, you get more points as early as you figure out the Mega Connect. But personal experience is that you should wait towards the end so that the picture gets clearer, because 1 or 2 or 3 questions may give you a false sense of a connect. Whereas
no, they can give the answer after. They can take a attempt for the Mega Connect after every question, right?
No. We are clear on this, Chaitanya. I'll have you shut the fuck up. Okay. So you have one guess which you can get anytime, like one guess at any point after first question or after 5th question, as are the answering for every one of the questions. I'll give you a window for guessing the Mega Connect as well, and you can guess the Mega Connect after the window, like whenever you get the window, right? But essentially only one time it will be kept a score that who attempted the mega connect. You cannot attempt it again. And every question is standalone, and you can even enjoy every question as a whole, right? So the rules here, the round contains 5 questions, and any number of teams can answer the question each separately on DM. 30 seconds will be given per question, as was in the differential round, and unless mentioned otherwise, of course. Each question is of 20 marks and negative marking of 10 points for each team which gets it incorrectly. This is in stark contrast to what the differential round was. So take that in mind. The Mega Connect is worth 60 minus 10 n points, where n is the number of questions after which you have attempted the Mega Connect, and each team can attempt the Mega Connect only once, right? And these kinds of stuff does not work that you will say key the 2 things or the 3 things were explaining the Mega Connect. Only one Mega Connect that is explaining all of the 5, which may or may not have come up yet, is the correct answer. So waiting for the image to develop is a better choice, right? 6 teams have yet not been eliminated and will participate in this round, right?
Does
So
the Mega Connect also have negative marking?
No, but you can only attempt it once, right?
Okay, cool.
So better yet, after the 5th question, I'll ask all of you to attempt it anyway. Okay. So the first question I'm presenting, again, 30 seconds pounds window. Pounds, essentially everybody is on pounds, right? It's not directed to anyone. And every question is separate plus 20 minus. So this is the question. Porphyrin metabolism can cause, one of which are acute intermittent porphyria and porphyria cutanea tarda. A heavy metal X present quite frequently in paint can cause toxicity, one of whose features is similar to congenital porphyria. 2 of the enzymes in the porphyrin pathway are affected by this metal X. Identify this metal X and these 2 enzymes that it affects. And we also have the pathway here so that you can look at it if you don't remember the pathway itself, right? There are 2 enzymes which this metal X inhibits. Okay. And the pounds window has started. I have got a pounds already for Aniket, which is absolutely correct. You'll have to give me one message with X and the 2 enzymes that it inhibits, right? Shubhro Jyoti has also attempted and he is also correct. Again, you can look at the question, identify X, the metal, which inhibits 2 enzymes and presents similar to congenital porphyria. And 2, okay. Mokshal has also attempted it, which is correct. And 10 seconds more in the pounds window. Bhavya has also attempted, which is also correct. And that's about it. The window is closed. And the answer is lead is the metal which inhibits ALA dehydratase, which is this step, and ferrochelatase, which is the last step, right? These are the 2 steps that is inhibited by the metal X, which is lead, which is often used in paint or often not, rather marketed as not to be used, right? So the answer was lead, ALA dehydratase, and ferrochelatase. So Bhavya, Mokshal, Shubhrojyoti, and Aniket get plus 20 each for this question. Now I'll move on to the next question. Anybody want to attempt the Mega Connect now? 10 seconds more if you want to attempt the Mega Connect, though I will strongly oppose if you attempt it after the first question. You have to remember that the first question was related to lead, was related to porphyrins maybe, right? Okay, so first question was related to lead, remember that. And now I haven't got any responses as I did expect. We'll move on to the next question, right? Next question again, similar concept. This is the question. Alcoholism is a very common problem and is quite relatable to us as medicos. Leaving aside the chronic complications of liver diseases and portal hypertension, even the acute symptoms have interesting explanations. One of the most relatable symptoms to us is throwing up, right? Which is sometimes thought of us as compensation for the acidosis that alcohol causes. What's the cause of this acidosis biochemically? Right? Some people think about it as compensation for the acidosis that is biochemically caused, which is relieved by vomiting, or the acidosis acts on some central pathways which cause. vomiting. So what causes the acidosis biochemically? That's the question. I want a funda with like as many technical words as you can use, and the window starts now. Note that acute symptom of alcohol is acidosis. What's the cause? Okay, so Bhavya has attempted and is correct. I'll give you marks, full marks. 10 seconds left in the pounds window, and I have just got 1 pound. That is Bhavya, who is correct. Okay, so the window is over, and there are several components to it. There is lactic acidosis, there is acetic acid that builds up due to metabolism of alcohol, and there is also ketoacidosis. So even if you would have answered any one of them with an explanation behind it, that would have got you marks. But the essential explanation is the NADH to NAD ratio that is increased due to the metabolism of alcohol. Alcohol is metabolized to acetaldehyde and acetate, which both give NADH, like they convert NAD plus to NADH, increasing the NADH to NAD ratio, which first of all stimulates ketogenesis. Then it obviously NADH to lactate is formed. Pyruvate to lactate is stimulated due to increased NADH to NAD, and acetate is also like a metabolite of alcohol, right? So 3 acids are generated. So Bhavya gets 20 marks for this, and nobody else attempted. I also have a 15-second window if you want to attempt the Mega Connect now. Reminding you, the first question was for lead. The second question was for alcohol. Okay, so shall we move on to the next question? Okay, so nobody attempted the Mega Connect even now. So we'll move on to the next question, the third question. The third question is this: tumor lysis syndrome is a clinical condition that occurs spontaneously or after initiation of chemotherapy. It is most frequent oncological emergency. Tumor lysis syndrome is most common in patients diagnosed with leukemia who have very high white blood cell count. This can lead to fatal arrhythmias preceding death without adequate management. Why would this tumor lysis syndrome cause an arrhythmia? The window starts now. Bhavya has guessed and it's correct. Bhavya gets plus 20. Five seconds more. Only one attempt I have got yet. Okay, so the window is over. Okay, I'll consider one more. Soham has also gotten it correct. Soham and Bhavya have got it correct, plus 20 to each of them. Essentially the answer is the hyperkalemia that is caused due to the cell being like the cells broke because the tumor lies, and because the cell itself is has increased potassium than the extracellular fluid. That potassium leaks out in the extracellular fluid and causes an extracellular hyperkalemia, which is a risk factor for arrhythmias, right? So hyperkalemia is the answer. Hyperkalemia, which is caused by tumor lysis syndrome. Now 15 seconds more. If anyone wants the Mega Connect. Again, reminding you, the first question was for lead, the second question was alcohol, and third question was somehow tumor lysis syndrome or hyperkalemia. 10 seconds if anybody wants to attempt the Mega Connect. Okay, so I haven't even got a attempt yet, so I'll move on to the next question. Right, the next question is this: a 6-month-old baby with doll face, hepatomegaly, fasting hypoglycemia, acidosis, anemia, hyperlipidemia, hyperuricemia, and acetonuria presented to the hospital. Diagnosis was confirmed by light and electron microscopic examination of the liver biopsy specimen which revealed hepatocytes filled with dense pool of glycogen and many lipids. Cornstarch dietary therapy for him had favorable responses, showing improvement of the hypoglycemia that was caused due to excessive fasting. Other metabolic derangements and regression of hepatomegaly was also caused by cornstarch dietary therapy. Which genetic condition was predicted and therefore diagnosed by electron microscopic examination of liver? And what is the enzyme defected in it? And there is no part points here, so you will have to give me the entire answer as correct. Then only I will be able to give you plus 20 marks, and even minus 10 is there. Minus 10 even if you attempt half of it. Which genetic condition was predicted here, and what is the defected enzyme in it? The bounce window has started. You'll have to give me one message with both the condition as well as the defective enzyme. Presentation here, the diagnosis criteria and the therapy. Okay. 5 seconds more. I have got a pounce from Bhavya, which is correct. And nobody else pounced. Okay, I'll consider this as well. Mokshal also got it correct. So as they rightly pointed out, it's von Wieck disease, which is a type of glycogen storage disorder, which therefore causes fasting hypoglycemia and is due to defect in the enzyme glucose 6-phosphatase. So Bhavya and Mokshal get plus 20 each, and none of the others attempted it. Now 15 seconds more if you want to attempt the Mega Connect now. Reminding you again, the first question was from lead. Second question was alcohol. Third question was tumor lysis syndrome. The fourth question is von Wieck glycogen storage disorder. Anybody who would like to attempt the Mega Connect, this is the time.
Bhavik, Shubhrajyoti has lost his connection and वो meeting से निकल गया है. He has just messaged me कि he starts trying to join it.
Okay. So we'll wait. No problem. Has he missed a couple of questions? Because we'll not be able to compensate for them.
He has missed this question. I think I'll ask him, but
no problem. We'll just give him the information that von Wieck was the correct answer, and then he can participate in the fifth question itself. Give me an indication when he arrives, right?
I'll tell.
Okay. I think he is here. I don't know. It shows to me that team 8 Shubhrajyoti is here. Shubhrajyoti, whenever you come, please give me a clue. Okay, so scoring in this one was like Bhavya and Mokshal got it correct, von Wieck disease, right? They get plus 20 each. Okay, Shubhrajyoti is here, and Shubhrajyoti, the only information to you is the 4 answers to the Mega Connect till now. First was lead, second was alcohol, third was tumor lysis syndrome, fourth was von Wieck, and we'll move on to the fifth question, which you can attempt with everyone else, right? So yes, the answer to this one was von Wieck, glucose. Hello, Hardik?
To organizers only.
Change to organizer only. Yes. Okay. So we'll move on to the next fifth last question of Mega Connect. A 3.5-year-old male child was brought by his parents for seeking consultation for his skin problems. Parents reported that the child was scratching and damaging his various. The parents denied any history of any itchy skin disease in other close family members. These ulcers were present only over the areas which were easily accessible for scratching. His detailed systemic evaluation revealed delayed developmental milestone, difficulty in social interaction, head banging and aggression along with attention deficit, making him a school dropout. His routine blood biochemistry was normal except for low hemoglobin level, 8.1 gram per deciliter, and high normal uric acid level, 9.48 milligram per deciliter. What is your proposed diagnosis and the biochemical basis of the syndrome? So I want a diagnosis. Okay. Shubhrajyoti has already attempted it and got it correct. I want you to answer both of them, the biochemical basis and the diagnosis. I have accepted Shubhrajyoti's answer, though I would really have him answer both of them in one message from now on. Okay, Aniket has also given also gets 20. The bounce window is still open. Bhavya has also attempted it correct. She also gets 20. 5 seconds. Okay, we are done with the window, and only 3 people got it correct. Only 3 people attempted and got it correct. Mokshal, Aniket, and Bhavya, all of them getting 20. Now is the final time to guess the Mega Connect. None of you had attempted it earlier. I'll remind you, the first question was from lead. Second question was alcohol. Third question, okay. Oh yes, 4 people. Shubhro, Mokshal, Aniket, and Bhavya. 4 people have got it correct. Sorry. Okay. Bhavya has attempted gout, which is not, it's close. It's not the correct answer. Anybody else? Okay, so there's a window for this too. 15 seconds. Okay, so nobody seems to be attempting this. So this was a Mega Connect with no use of the Mega Connect. Anyway, whatever. Things don't always turn out as you plan them to. So the Mega Connect is hyperuricemia. Okay. Hyperuricemia is the Mega Connect which connects all of them. Gout is not anyhow synonymous to hyperuricemia. Hyperuricemia is let's just say a risk factor for gout, and it can present gout can present due to hyperuricemia, and hyperuricemia may be disassociated with gout, right? Even in patients who present with gout, the uric acid levels may be normal, and the other way around. Like uric acid. So I would not give any marks for gout, but just take away that the answer was hyperuricemia, which is caused by all lead poisoning, excessive alcohol intake, and von Gerke disease, tumor lysis syndrome, and obviously this was supposed to be a giveaway, Lesch-Nyhan syndrome, HGPRT deficiency, which is essentially where urea increases, right? So Hardik has put out the scores in the chat. I would want Hardik to speak them up also.
Okay, so at the end of this round, Aniket is at 127. Bhavya has answered all the questions in this round, so she has come to the top with 220. Bhavya 220. Mokshal is at 140. Simar is at the bottom with 65. Soham 128, and Shubhro is at 116. So Aniket 127, 220. Mokshal 140. Simar 65. Soham 128. Shubhro 116. Keep track of your scores because these are important for the order of this round.
Yes. So, Hardik, can you give me a scoring with ascending order of marks, both in the chat and speak it up? Like you can take your time.
So I will just write the order of the teams. So at the bottom most is Simar, team 6. Then after that there is team 8, Shubhrajyoti. Then after that there is team 1, Aniket. Then there is team 7, Soham. And then team 4, Mokshal. And at the top, team 2, Bhavya. Correct me if I was wrong, but the order, please, एक बार आप लोग भी check कर लीजिए. So this is the wrong order. 6, 8, 1, 7, 4.
I also written down in the chat the order, increasing order of your chances with name. So what this round is like your score, and you decide the level. The level of the questions are breathtaking here. Okay, so take this from me. Most of you would not be able to answer most of the questions because they have been set to not be at the level of normal thinking, right? They are set to be a bit difficult, but because they are worth so much, right? You can decide what the question would be worth with a maximum cap of 50% of your total score, right? But whatever you decide the worth for the question, that same amount would be its negative value for getting it incorrect. Though you can always choose to leave the question and get 0 marks, right? we will be giving the option of choosing your question. It's just a number, not exactly the question. Starting from the one who is at the lowest point and all the way getting up to Bhavya. So we'll go. This the advantage, or whoever was made to whoever is at the first position, the advantage that he could bet his or her point after seeing what the other people performed at, right? So you can bet maximum of 50% of your total score, and you can get correct or incorrect same number of marks, and 0 marks if you do not attempt it, right? There is one question here. All of the question would be like 60 seconds would be given. There is one question that is particularly time taking, so that one question will give 2 minutes. Rest of the other questions 60 seconds are enough, right? And this is the matrix. You will have to decide one number for yourself. We'll give you a hint as to what the question would explore, and then you can decide your bet, and then we can go towards the question. 1 minute is for the most questions. One question is of 2 minutes, right? Now I would invite Simar to speak up a number, and then I'll show you a hint to what the question would be like. And Simar.
Hello. Actually, could you repeat? The voice was cutting. I just heard till decide your number. After that.
So these numbers are just every number of them. Every number has an associated question with it, right? So whenever I push one of the number, it gives me an image that is representative, not exactly, kind of representative of what the question would be. It's kind of a meme similar to that question, right? So I'll first invite you because you are at the lowest point. Then we'll go in ascending order, and then you choose a number. We'll give you the image corresponding to it. Then you decide a bet. Then you decide what the question is worth up to maximum of 50% of your total score. And then you attempt the question in 1 minute or 2 minutes if you are that lucky, and that determines what if you get it correct, you get the points that you bet it. If you get it incorrect, you lose them, and you can. Was I clear and both in the audibility and the
Bhavik, your voice was not clear towards the end. What happens if she does not attempt?
So if you do not attempt, it's obviously you are not getting any marks, and you are not even losing them. You get 0 marks. So it's a safe thing. Like you can, numbers are just for choosing questions. So if you do not attempt, you get 0. If you attempt correctly, that you get plus whatever you betted, and negative if you get it incorrect, whatever you betted. Right? So we had you choose the number so that the difficulty in the question could balance off with luck, right?
Okay, so I'll choose number 3.
Simar, I would want you to speak and give me a confirmation if that was clear, and choose a number.
Yeah, it was clear. I'll choose number 3.
Okay, 3. 3 it is. This is the image. Okay. Now I would want you to bet whatever. You can bet a maximum of what's the score? You can bet a maximum of 32 points. What would it be?
All 32.
All in? You're getting all in 32 points?
Yeah.
Okay. So this is the question. 1 minute for you. Nobody else is supposed to attempt this question, right? This is only for Simar. This is the question. I'll read it out, then the 1 minute start. A person comes to the OPD with symptoms of increased appetite, sweating, anxiety, and weight loss. On examination, there is swelling in the region of the neck. Eye examination reveals following findings. Diagnose the condition, and I shown, which is called the lid lag sign. You have to give me the diagnosis of this patient and the funda behind this sign. Both of them correctly will only give you. So why is it not playing? Okay. So anyway, I'll not go to an external website to play it. I'll give you that the lid lag sign is when you instruct the patient to look down and up, and his or her lid lags behind his or her pupil. Right? So pupil comes down earlier, and the suprascleral angle is visible. That is called the lid lag sign. right? Because the eyeball comes down lower and the eyebrows, the eyelid comes down slower. So the suprascleral angle is visible, which is not visible in a normal patient. This is called the lid lag sign. So with a positive lid lag sign and the symptoms shown here, diagnose the condition and give me the funda behind it. You are not getting any marks just for diagnosis. You are getting only when you diagnose the condition, give me the funda behind it. And your time starts now. I don't know, like time is irrelevant here. The funda is important. Like diagnosis is pretty easy here. The main question is the funda behind the sign. Give me an indication, Simar, if you have like read the question, if you're clear with the question.
Oh, yeah, I have read.
Okay.
So the images, please.
Okay. This is this is the suprascleral angle, right? The eyelid and the eyeball, eyeball and eyelid between them is the suprascleral angle, which is not normally visible. But in these patients, when you
no, like, those images, the 4 images.
That is not related to the question, right? That is just a indication. That does not help you in any way. So attempting that gives you 32 points or takes away 32 from you. So what's it gonna be? 15 seconds left. Are you attempting this?
The diagnosis would be hyperthyroidism, I think.
Okay. What's the funda? I can't give you anything. Like I would rather want you to say that I am not attempting than giving me an incorrect, like an incomplete response, which would be considered incorrect. So are you attempting or not?
No.
Okay. So the answer, as you said, it's hyperthyroidism. True. It's the funda behind is there's a muscle that helps the levator palpebrae superioris elevate the eyelid, which is called the superior tarsal muscle or the muscle of Muller, which is sympathetically supplied, right? And because thyroid is a its main action is permissive for epinephrine and norepinephrine and the sympathetic mediators. Hyperthyroidism essentially enhances the sympathetic supply, and the superior tarsal muscle is always contracting. So if the superior tarsal muscle is always contracting, the eyelid is always open and closing it is slow. So there is a lag between looking down and closing the eyelid. That's the funda behind the lid lag sign in Graves' disease. Okay. He rightly diagnosed the condition, by the way, but that does not give you marks in this, right? Now, I would invite who's the next Shuvro Jyoti to pick a number.
2. Am I audible?
Okay. Yes. 2. So you have picked the 2-minute question, and it's really mathy. So I would want you to take out a pen or whatever, get prepared, because this will be a time crunch. It's a 2-minute question, but anyway, it's like I'll read out and then it's 2 minutes, right? Okay. So question is this: often multi-subunit enzymes are various subunits that are products of different genes, and specified number of them come together to form an isoenzyme form. Wait, am I not audible? Okay. Various number of them come together to form an isoenzyme form. These subunits can have specified positions in the bound enzyme form, or all positions can be equal. An example of the latter is how LDH being a 4-subunit enzyme, and each subunit has 2 forms, H and M, and total 5 functional LDH enzymes are possible. If, for example, HHHM and it was not equivalent to HHMH, so H3M would have 2 forms, as is the case for some enzymes with position specificity, right? The total number would have been different. So calculate the possible number of enzymes possible for a hypothetical 5 subunit enzyme with each subunit having 3 gene loci, such that first of all, where each position is equivalent as in LDH and all positions are different. So as LDH had 4 subunits and each subunit has 2 gene forms, H and M, this enzyme has 5 subunits. Each subunit has 3 gene loci. Let's call them A, B, C. Right? You have to give me the number of these enzymes, isoforms possible when first each position is equivalent as in LDH, like H3M makes 1, not 4. And second is when all positions are different and therefore HHHM is different from HHM. Your time starts now. A and B separate answers I want, and I want both of them correct to be considered a correct response. Oh wait, I did not ask you for the points that you were betting. Okay, so just give me the points you're betting. Is it
I will bet with 40 points.
Huh?
40.
Max?
40. You bet with 40 points. 40.
Okay. Give me the
44.
Okay. I got it. 40. Yeah, Shubhru, you can write it down here. It works, right? You can give me an answer in the chat. Anyway, 45 seconds are done. So you have 1 minute 1 minute 15 seconds or so left. Okay. So okay. Is that your final answer? Are you attempting it and giving me that answer? Like, give me an indication. I am attempting it, yes, and then this is the answer. Okay. So the answer, one of them is correct and one of them is incorrect. So you lose points. You lose 40 points. Right. So the answer, what he attempted was 10 for case 1 and 243 for case 2. For case 2, it's like quite easy, right? You just give the 3 gene loci, all the 5 positions, 3 to the power 5, that is 243, as he surely attempted, right? For the first question, it's kind of like asking that A, B, C are the number of A's, number of B's, and number of C's there, and A plus B plus C equal to 5, and A, B, C are are whole numbers, are greater than equal to 0 and are whole numbers. So that is essentially a problem in combinatorics. Like you could have made it out and you could have used the multinomial theorem. Anyway, so Shubhro gets minus 40 for this, right? We'll move on to the next participant, who is, let's see, Aniket. Aniket, choose a number.
Okay, I'll go for 6.
6. Okay, we'll get you 6 to 1. Yeah, this is the indication. What would you be your bet?
50%.
50%. What's his score? His score is 127, right? So that would be what, 63? Yes, 63 points. Right.
Yeah.
So I'll start off the timer as soon as there is not much reading in this question. So the figure shows 3 line viewer Burke plots, the double reciprocal plots for enzyme action, right? For 3 different kinds of enzyme inhibition reactions. Name the types of inhibition seen in A, B, and C respectively. All 3 of them correctly in order. If you want to attempt, then you can. Otherwise, it's 63 points on the line. The time has already started, right? You get 1 minute to this. First of all, give me an indication that you do want to attempt in the 1 minute, and then we can attempt it. Right? Okay, so I would want that confirmation in the next 15 seconds. At least the confirmation that you are or aren't going to attempt it. Aniket, it's 5 seconds now, and I would consider that you aren't going to attempt it now.
No, I'm not going to attempt it.
Can you please respond, please?
No, I won't attempt it.
Okay, sure. So, yeah, he did not attempt it, and the first A1 is competitive inhibition. As you can see, there is a component of like this alpha. Essentially, it the Vmax remains the same, whereas the Km shifts by alpha into the normal Km, right? That is competitive inhibition. The second one is uncompetitive inhibition. Uncompetitive inhibition is when, okay, I'll show you something cool. So this is the normal enzyme action, right? Enzyme plus substrate is enzyme substrate complex, and enzyme plus products are released. So inhibitors can act on two platforms here, right? They can act either on the enzyme without a substrate, the enzyme inhibitor complex, or they can act on the enzyme substrate complex, forming the enzyme inhibitor complex. When they act on the first part, right, and on the enzyme inhibitor, on the enzyme itself and from the enzyme inhibitor, it's called competitive inhibition, and it gives a change in Km only, right? Because Vmax is determined only by this reaction, and this reaction is not at all inhibited or messed up with. Whereas when there is uncompetitive inhibition, there is change in both Km and Vmax by the same extent, because this step controls both Km and Vmax, right? And that is the alpha dash that was mentioned there. Mixed inhibition is a criteria where both these inhibitions simultaneously happen. And maybe you guys have heard about, there's something called non-competitive inhibition. Non-competitive inhibition is a special form of mixed inhibition, wherein both these alpha and alpha dash, because of uncompetitive and competitive inhibition, balance each other out, and therefore the Vmax, the Km remains constant, right? So you can see here, the Km in mixed inhibition is alpha dash upon alpha Km. So when alpha dash equal to alpha, then Km remains constant, and this intercept comes here rather than there, right? When it comes here, then it's a special type of mixed inhibition called non-competitive inhibition. So I hope this question is clear. Now we'll move on to, so Aniket did not attempt it, so he does not get any point, right? Now the next, Soham, you have the turn to choose an option, right? I guess 2, 3, and 6 are done with. Yes.
I'll go with 4.
4. Cool. Now, what's your bet? Your points, as I see them, are 128, right? Yes.
Yeah, I'll bet 12 of my points, like whatever the percent that is. 12 points.
Okay, 12 points are you betting. Okay, 12.
Yeah.
Makes sense. So you are playing this question for 12 points.
Yeah.
Here is the question. I'll read that out. Respiratory diseases can be modeled on the basis of pressure gradients generated and air flow across it. Generally, during expiration, the pressure that forces air out, TA, is the sum of the transmural pressure created by the muscles between the pleural space and the atmosphere, the trans-chest pressure, and the transmural pressure created due to the lungs' elasticity between the lung and the pleural space, right? That's the transpulmonary pressure. Therefore, a gradient exists from the alveoli to the atmosphere. Whenever the pressure inside the respiratory tract reaches below the pleural pressure, right? Then the pleural pressure is enough that it can compress the pressure in the respiratory tract. A 0 point exists because the respiratory point. This 0 point normally exists in the ringed part of the tract, but when it does not, certain pathologies can result. 2 of such model chronic pathologies are demonstrated. I'll demonstrate it in the next slide. So 2 of these pathologies where the 0 point is shifted away from the cartilaginous region to the distal part so that it can really collapse are depicted here, A and B, and they are part of something called an umbrella term of COPD, chronic obstructive pulmonary diseases. you have to identify A and B and which diseases do they represent amongst the COPDs, and you have to identify which pressure flow flow volume diagram represents COPDs. So A and B are two diseases that are classified under COPD, and one of them is the flow volume curve that represents the COPD. You have to give me all of them correct to get your 12 points. Which diseases do A and B represent separately, and which flow volume curve can be representative of them? Note that there is only one flow volume curve for both of them, because I am essentially asking the flow volume curve for COPDs. And two types of COPDs are A and B. Essentially the same pathology due to two different reasons. Soham, I would want you to confirm in the next 15 seconds if you are attempting this. Soham, I need you to respond.
No, I won't go for it.
Okay. So I'll give out the answer. A, as you can see, there is mucus edema and bronchoconstriction, which increases distal airway resistance, right? And because airway resistance distally increases, the pressure gradient is more in the distal part, and therefore the 0 point occurs much distally, right? So when it occurs distally, it collapses because the cartilaginous part is not yet here. This is characteristic of chronic bronchitis, right? The distal part get due to inflammation or due to like various other secretions and bronchoconstriction, the resistance increases. This one here, the elasticity of the lung has gone down, right? As you can see, the PEL, or the elastic force transpulmonary pressure generated by the lung, is only 10, whereas here it was 30. Right, this has gone down because the elasticity of the lung has gone down. This is characteristic of emphysema, wherein several other factors, including alpha-1 antitrypsin deficiency, causes destruction of collagen and stuff, and therefore the lung is not elastic enough. And here is the flow volume curve for normal obstructive diseases, which represents a scooped out later portion of the flow volume curve, right? So the answer is chronic bronchitis. This is emphysema, and B is the correct flow volume curve. Cool. Soham did not attempt this, and therefore does not receive any marks. Right. Now returning to the decide your question. Right. Okay. Now it's time for Mokshal. Choose a number. Only two numbers are left now. Which one? 1 and
I'll go for
4.
1.
1 and 5. 1 and 5 are left. You'll go with 1, right?
Yeah.
Okay. What's your bet?
My bet is 11 points.
11 points. Cool. Your bet is 11 points. And preparation years before us, let's get the question. As we know from Vidal and Tatum, proposed the one gene, one enzyme hypothesis to explain gene function. Right? Quite recently, it has been proposed that one gene product can carry out multiple different enzymatic functions, as did many people who used to work a different profession during night, amidst moonlight, to sustain a living. Am I clear? Yeah, I heard there's some disturbance.
Yeah.
Okay. So quite recently, it has been proposed that one gene product can carry out multiple different enzymatic functions, as did many other people at that time amongst moonlight. So these gene products have been called moonlighting enzymes. A frequently quoted example is a TCA cycle enzyme, aconitase, that catalyzes citrate to isocitrate reaction through an intermediate aconitase. This enzyme possesses an essential iron sulfur cluster, and as a part of its role, when this cluster is replaced or removed, the enzyme loses its aconitase. This iron sulfur depleted aconitase or apoaconitase has a different function in metabolism, acting as an enzyme or protein called X, which acts on Y. Identify X and Y. Your hint with this is that homeostasis always finds. I hope the question was clear.
Yeah.
Okay. You get 1 minute to decide if you're going to attempt that, and then
I think I'll pass.
Okay, you pass. Okay, so that was a really quick decision. I appreciate that. What happened here was that aconitase, which had an iron sulfur cluster in it, when iron deficient conditions arose in the cell, what happened was that because of this iron deficiency, the body needed to, because of homeostasis, the body needed to transferrin expression and decrease ferritin expression, right? So apoaconitase acts as the iron response element binding protein, which acts on the iron response elements in the genome to increase transcription of transferrin and decrease transcription of ferritin, which are the normal responses to, like, normal responses to a iron deficient condition, which would be induced because iron sulfur cluster would be depleted when iron deficient conditions arise. So the answer I was requiring was that it acts as an iron response protein or iron response element binding protein and acts on the iron response element, right? Okay. So now I'll invite Bhavya to give us a bet, though I don't think this means a lot now.
Do I really need to play?
Okay. So this is like in the spirit of you can play for 0 marks as well. Okay. So you are not in the position to decide. Do you want to play for 0 points?
Okay.
Do you want me to open this question to everybody and scrap it in terms of being competitive?
Fine.
Your choice. Huh?
Yeah, sure. Go ahead.
This is a really good question. I don't want to like skip this question anyway. Okay.
Yeah, sure.
So this is the question. These are 5 conditions that have been mentioned, and there are 5 electrophoresis for serum electrophoresis that have been also shown here. You have to match them with each other, and only all of them correct would have given you marks. Not that you need them. I am not even going to do the effort enough to have a timer on this one. Okay, Bhavya, you can answer whenever you want. Yeah, take this question. Maybe. But I'll need to give the answer away for the audience. So give me an indication that you are attempting or not.
One would be C. One would be E.
One would be E. Okay.
No, wait. Multiple myeloma, gamma globulin. Acute infusion.
Okay, so are you attempting it or not?
Oh, go ahead. Just reveal it.
Okay. So acute and chronic inflammation will deal at the last. First of all, the obvious one. As you can see in E, the gamma globulin is like a real tall peak. So that is multiple myeloma because there's a monoclonal gammopathy, right? So 2 is E. Liver cirrhosis, as we all know, the albumin globulin ratio would decrease. So globulins would in general increase, whereas albumin would be down. So C is liver cirrhosis. Nephrotic syndrome, what happens is the small proteins are removed earlier, whereas the bigger proteins stay because there's like an increased filtration, right? So alpha 2 globulins are the biggest globulins there exist, globulins and albumins alike. Albumins is one of the smallest and alpha 2 are one of the largest. So alpha 2 are increased because of decrease in total protein and therefore increase in their production, right? So albumin would be severely decreased and alpha 2 would be severely increased in nephrotic syndrome. So D would be nephrotic syndrome. Inflammation. So inflammation, what happens is initially the C-reactive proteins and other acute phase reactants increase, which are represented by the alpha and beta globulin fraction. So A would be acute inflammation, whereas antibodies and stuff would later increase during chronic inflammation. So B is chronic inflammation. That's how you solve this. So like just for formality, Bhavya gets 0 marks for this, right? That brings us to the end of this quiz. Hardik, with the scores, announce the winners, please.
So Bhavya is first with 220 points, and second is Mokshal with 140. Soham is third with 128. Then fourth is Aniket with 127. Fifth is Shuvro, 76. Sixth is Simar with 65. So basically,
So
first,
first, second, and third can contact me for receiving their prizes. Right? I hope you know what prizes are there. Right? You can contact me for the prizes. And feedback are welcome. Like you guys are supposed to be the winners of the last round, so your feedback is pretty essential to us. And any one of the winners, if you want to give a treat to the quiz master, that would be appreciated. Okay.
I would like to add.
So should we close now?
Shut the fuck up.
Sure. Chaitanya Mittal ko nahi dena hai iska matlab. Okay. So any more comments, any more feedback that you would like to give at this moment? We're ready for that as well. Anyway, in the group, we'll ask for it again. Okay, we can
I would
this, I guess.
that,
yes.
I would rather say if I were to get the second question, I would fail. Literally,
okay.
like
So you would have
combination question.
You would have confidently got.
Yeah.
Incorrect, you mean? Like there's also a confidence part in this question, right? You can always leave it. Even if you left it, you would have been first anyway. So leaving it, who did got it correct? I guess nobody got any of the betting questions correct, right? So there's that too. Anyway, we'll finish for now. I hope this was a good experience as much as the euphoria for someone who has won it and is awaiting cash prizes. It was a good experience for us as well. We would like to do more such stuff and would also encourage you other guys to also be involved in making new quizzes and inviting us as well. Thanks from my team. I am Bhavik Bansal from AIIMS, your quiz master for today. And I would like to introduce my team to you. The scorer today was Hardik. Oh, maybe I'll keep it to the people to introduce themselves. And then I'll introduce the rest of them who are not here. Hardik, let's start with you.
Hi, I'm Hardik Gupta. So I was keeping the scores today. I had fun making this quiz. So I hope आपको भी मजा आया करने में.
I had okay. So guys, my name is Chaitanya Mittal, and I literally did nothing for this quiz right now, but I helped in making the questions and everything. I was just there to ensure.
There were many people involved.
Midway through the quiz, you would have a spare quiz master.
Okay, sure.
Something I was counting on.
So anyway, many people were there who were essential in making the questions and who are not present currently. So I'll acknowledge them. Rishi Gupta, Amritesh Singh Grewal, Ayush Gupta, Chaitanya Gupta, and you all met Chaitanya Gupta, Ishan Gupta, Ishika Gupta, and there was one senior, 8th semer, who was guiding us, Lajja Patel. And that's about it for the team. Anyway, we would appreciate if you guys also conduct many quizzes with great rewards and invite us and keep the quizzing league in Delhi medical colleges prospering, so to speak. I guess we can end it now and we can talk in the WhatsApp group itself if there's some feedback or there's some new stuff that we are planning or whatever, right? Okay. So let's end this meeting.